bend the knee, hold onto the knee, hold on to the back of the pelvis, scoot towards me, and help them. And then once we make contact, we don't break that. You already set yourself up, so you're not going to fall off the table, but we don't break this contact for those patients that are kind of right on the edge, or they're a little bit nervous about this, or they don't know what's going on. So now, let's just say we got a PI ilium. So that's like this. I want to make it do this. All right? So I have to push on the PSIS to make that happen. But just pushing on the PSIS is not going to do anything to anybody. Or we could just have our patients line up and just whack them right on the PSIS. And I honestly wish that would happen because we wouldn't need all this complex stuff. So give me your arms. I'm going to put them down here. So I get my contact on the PSIS like that. I need to take my thigh on the patient's thigh to use this as a lever, or lever for those of you that say it that way, so we can open up the SI joint. So if I do that, I'm getting a little bit of traction on the SI joint. And then once I get that traction, then I can add that force into there. So we're thinking about it like this. We open up the SI joint, and then we do that to it. Whether that's happening or not is debatable, but that's kind of the way we're thinking about it. So I use my thigh on the patient's thigh. Notice how I'm putting pressure, which is doing this, but I'm not doing this. I'm not rotating, because I do that, and now we're in the lumbar spine somewhere. So I put pressure like this, make sure I can get my body down, and then I do the exact same thing we did with the lumbars. I need to move all of this here. So I keep everything where it is, and I rotate it over here until I can pin the patient down on their hip. And now I can keep tension on my arm, come up a little bit, drop down, and stab her with my keys.
Yeah.
Right in the lung.
Yeah, ilium.
That's for a PI, yeah. I can do the same thing, set it up for a PI without a lot of torsion in the back, and turn that into a PIR. How am I going to ask her to contract?
Just your hands straighten out.
Yeah.
Roll back onto the table.
Yeah, what I want you to do, no, that's rotation. I want her to actually push into my hand here like you're tucking your tail. Well, what are you doing? You're killing me. You have to try to throw me across the table. And just a little bit. So I usually will say, push into my hand, which is on the PSIS, like you're tucking your tail. Because essentially you want them to do this. Push into my hand. If I just tell them to push into my hand, some patients they'll just spaz out with their body because I got a hand here, I got a hand there, just like a hand. So I almost always give that two parts. Most people, when I tell them push in my hand, totally fine. But I've had the occasional patient that just has no clue what that is. Plus, technically, I have two hands on them. So the engineer types will be like, "You have two hands on me." So I've had that happen enough, and I've worked with Intel workers enough where I'm like, "All right, I have to explain this a little more." And really, it's the tucking the tail part that seems to matter. They're actually getting a much better contraction with that. And then once they exhale and they relax, I can move that into the next barrier. AS ilium, that's gone this way.
I have a question.
Yeah.
When you're moving into the next barrier, do you
You just push, really.
just with
Yeah,
the
it's just,
contact?
you just kind of lean your body weight into the contact a little bit more.
Yeah.
Yeah. So AS ilium is like this. I got to turn it this way. So basically, I'm going to use this leverage, but also the hip flexion to help me with that. And the contact's basically going to be palming the basketball. It's the ish too, but it's like you're palming the entire innominate, like this. You don't want to put your hand on a point because it's not helpful. Because essentially, we want to take this whole thing and rotate it that way. So, grab like that. I need to just scoop. I need this for AS ilium. I need to scoop the tissue, basically take a tissue pull like that. As I do that, my thighs against her shin are going to flex her hip up a little bit, and then I need to roll everything over until I'm there. And now when I drop, my legs go like this. That does this to her hip, and then I can drop on this part of my contact, which does that. But you got to make sure that's there. So it goes from her shins on my thighs. When I roll her over, it's kind of like shins on half of my thigh and my knee. So she can be rolled over. What some people do is they keep that shin on the thigh, and then they can't roll the patient over. Or when they roll the patient over, they also go down to the ground, so it doesn't help me. So I'm actually behind my contact here. I need to be over my contact. And then when I drop, My knees do that. Some people are like, my knees are too close to the table. Well, your knees are going that way. It wouldn't make sense to whack your knee into the table. Don't do that. And all of these you have to practice them so you can do all of those motions at the same time. And that's where a lot of people make a mistake where, because they're taught in steps, they do. Oh yeah, which doesn't feel like anything. So you need to practice them so you can do them all at once. So when you're actually going to do an AS, you take a deep breath, and then you exhale, boom. So you need that momentum, and it has to be one smooth motion. So you have to practice all those steps, but with the intention that you're going to put it all together into one motion. And that's really important when we get to sacral torsion. Let's take a 10-minute break. We'll come back at 10:30, and I'll go over. I'll let you guys do those.